Today, I'm happy to introduce Dr. Arnaud Bataille. He's a researcher in virology with CIRAD. Arnaud got his PhD at the University of Leeds in the UK on population genetics and disease ecology. Before joining CIRAD, he worked in several countries, including Ecuador, Netherlands, and South Korea. I don't know if I've ever seen those three countries grouped as one anywhere before, on the evolutionary and ecological processes associated with animal disease emergence. His work focuses principally on the peste de petits ruminants virus, PPRV, and he investigates transmission and evolutionary dynamics of PPRV with the aim of elaborating better control strategies. He also contributes to the development of new diagnostic tools and of vaccines against PPR, and he's co-head of OIE and FAO and EU reference laboratories for PPR. And we've invited him here today to talk about a new project that the EU has put together and that he's leading called LIDISKI. And I'm sure he'll explain more about that.
So thank you very much for the invitation and the introduction. So indeed, I will just present this new project. Well, it's actually not new. It's been running now for 2 years. So it's called the LIDISKI project that we are coordinating here at CIRAD. So you see we have multiple ways to have information about it. Not only we have a website, so we can invite you to go have a look if you are interested in having more information about it. Let's first look at really like the context of this project. We see here about the issue of livestock, seeing it as a lifeline against poverty, because we have the food security for smallholders is really heavily relying on their livestock as critical assets, because it's helping them coping with shocks. In case they need some income, well, they can sell some of their livestock to cover and cope with those shocks. And it's also very important to poor rural and peri-urban farmers. And here, in the case of this project focusing in Nigeria, well, we have actually more than 20 million Nigerian households that are really relying on their livestock for nutrition. And here there's a kind of a very important gender dimension also to this situation, because women are key stakeholders in poultry and small ruminants value chain. And it's really very supporting the smallholder farmers as helping them to enable access and affordability to animal proteins and to women empowerment in those regions. And that's where we see the threat of animal diseases that are affecting livestock as really important for the livelihood of these smallholders, especially in the changing world we are facing right now, because livestock diseases represent a big threat to the economy of the livestock owners and to the food security. And in the case of Nigeria and other countries in the Sahel region in Africa, they are also highly vulnerable to climate change, especially in the semi-arid northern part of Nigeria. All the agricultural sectors is quite vulnerable there, and it will change their practices, not only their mobility, and this will obviously impact their livelihood. And so really being able to adapt to the changes we are facing is crucial. And so it's in this context that we do put the project. So LIDISKI, what does it mean? It means livestock disease surveillance, knowledge integration. In other words, with this project, we try to integrate the knowledge collected from actors in the animal health sector to provide tools and know-how to implement sustainable surveillance and control strategies against livestock diseases. So that's where we were saying it's funded by the EU through a special initiative called DESIRA initiative. So basically, in few words, this project is about 2 diseases with 4 partners for 4 years and 4 different types of actions, and we will go through those points together now. So the 2 diseases are peste de petits ruminants, PPR, which is a viral disease affecting mainly sheep and goats. It's highly infectious, transmitted by direct contact. In Nigeria, it's estimated it's a global damage of more than $2 billion a year. And because of its wide global impact in Africa, Asia, and Middle East, There's now a global eradication program that's been launched by the OIE and FAO in 2015, aiming for eradication of the disease by 2030. Then the second disease is Newcastle disease. This one is affecting domestic poultry, another bird species, still a viral disease. Here it's also with high morbidity and mortality rates in chicken, and of course a major constraint to poor farmers heavily using poultry keeping for their economic activity. So it's kind of quite small project in terms of the consortium, the number of partners. We are 4 partners here. So CIRAD, which is a French international institute for research and development in agriculture. And we have as a second European partner, a veterinary institute that's based in Venetia. There is specialized reference lab for the Newcastle disease and avian influenza. So like this, we have 2 reference laboratories involved in this project, the one specialized with expertise in PPR and the other one with expertise on Newcastle disease, and really working with 2 partners in Nigeria. The main partner is the National Veterinary Research Institute, the NVRI, which is really it's governmental institute linked with the Ministry of Agriculture, with producing vaccines, notably vaccines against PPR, vaccines against Newcastle disease, and also involved in diagnostic and epidemiological work for the surveillance of these 2 diseases. And then the second partner is ICORE, is a private partner. It's really expert more in working for the engagement of communities in different types of agriculture actions, and notably for animal health. So it's going on for 4 years. It was launched in 2020. There's a picture for launch meeting in Abuja, in the capital of Nigeria. So it means that we are going on now for 2 years, and we'll have some update and outputs to provide you from the first 2 years of the project. And the activities of the project can be really grouped or summarized in 4 types of action with a central principle. Central principle is that if we want to have a sustainable surveillance and control of diseases, we need to have the local actors to gain competency and benefit from new tools adapted to their needs. And also we need to use participatory approaches, really integrating the local cultures and knowledge and socio-economic context in developing tools and strategies for the control of diseases. So based on this principle, we kind of have 4 types of action. One is about really capacity building of the animal health actors, about training, vaccine production. Then another one is really about all the actions about engaging the communities in surveillance and control of the animal diseases. A third one is more like the research actions to improve our understanding of the epidemiological and socioeconomic context of the 2 diseases and their impact on the communities. And from the outputs from the different actions, we go for the last action, which is about developing tools and guidelines for the policymakers, and see how the strategies and recommendation can be scaled up to be used across Nigeria. Because as you may know, Nigeria is a very big country, it's the most populated country in Africa. So we cannot work everywhere. So we decided to have very targeted actions, first working in a pilot area, which is in Plateau State, which is here. Why should choosing this place? Well, it's basically because the NVRI, our main partner, based their headquarters in the Plateau State. And then, so we would kind of test our protocol, start our activities there to see how things work. Then before moving to what we call target areas, other areas where maybe it's a bit more difficult to work, where actually ourselves we cannot go for security reasons. So that's where our partners, after being trained and capacitated, will go themselves actually just do the activities. And we decided on 2 areas that are connected to plateau through livestock movements and also activities of the NVRI, which is in Bauchi, just above plateau, and Kano, just the south of Bauchi. So let's first have a look at what we have been able to do so far about capacity building. So it's mainly, as I was saying, about training. So training the different types of animal health actors, so mainly our colleagues at the NVRI, both at the field and the lab level, but also working with field vets, working with the community animal health workers, which is here abbreviated as CAWS, and with livestock owners and staff of the Ministry of Agriculture. But another part is really about improving accessibility to vaccines, to improve the cold chain, because the vaccines for PPR and Newcastle disease are still thermosensitive, so you need to maintain the cold chain to deliver it to the livestock owners. And sometimes they are very difficult places that are very difficult to reach with very high temperatures. So maintaining the cold chain can be logistically very complicated. So we want first to improve with this storage and delivery to ensure the cold chain, and also improve their capacity of production at the headquarters for those vaccines. So in terms of training, well, I'm not going to go through all the type of training we did. Maybe I'll mention some that are especially interesting. So notably, well, of course, one of the main issue was how to do the training with COVID starting just after we actually started the project. So we first did a lot of online training with a platform for kind of MOOC and other type of online training. Is the PRISM platform. So kind of started there doing some online theoretical training, notably about participatory methods, with pre-recorded videos and assignment, and then doing some conferences. But after that, we managed still to be able to move and go to Nigeria, which was very important to do the second stage of the training, which really practical training, where we did go further in the training about participatory methods. So to see how they can design tools to use for participatory consultation, to the techniques for interviews, and design with them the protocol to do the first kind of field survey in the pilot place. And directly after the practical training, go in the field and test those protocols in villages that are close by NVRI, so places where it's kind of safe for us to go as well. So it was really important to do the testing and adjusting of the protocols. So kind of things we tried to do for different type of training, so doing some online training and then some practical and on-site training whenever it was possible. Then it means a lot of data being collected. So it means having training about data analysis for this type of surveys done in the households, where you need qualitative data type of analysis, text mining type of tools, and also quantitative data analysis, so both biostatistics, etc. So the second type of activities concerning capacity building, which has actually had quite a very interesting impact and output, was the installation of solar panels. So why installing and where installing solar panels? So as I was saying, NVRI, they are the producers of vaccines, and they actually have in every state of Nigeria, so there's around more than 30 states in Nigeria, they have an outstation. So they have outstation in every state where they can do the first kind of diagnostic work and also receive the vaccines produced at the headquarters, and from there deliver it within the state. So having a reliable energy supply in those outstations is very important. For the moment, until now, they had really big blackout and were relying on generators with using gas, and so they didn't have money to buy the gas, so sometimes they just couldn't ensure the cold chain and being able to work at all in the lab. So what we propose is to test installing solar panels in some of the outstations and at the headquarters for the storage of the vaccines, and see the benefit it could have for the activities at the outstation. So we did it for 5 outstations, including, of course, the ones where we will work in terms of target area in Bauchi and Kano. And it's mainly for supplying, of course, the refrigerators, but it's also used for the microscopes, etc. And we really had some good feedback from those solar panels at the outstation. So it did ensure continuous access to energy source with no more blackouts reported. So people at the outstation did say that they could at last resume their work for diagnostic with microscope, etc., and provide safe storage for the vaccines and their samples. Of course, also they reduced a lot their cost in terms of energy, so not relying too much on the public service or in buying gas for generators. And very interestingly as well, it seems that it increased the trust of the communities around just by seeing the solar panels in the outstation. Communities understood that the vaccines or medicine available in those outstations could be more trusted. They were more confident in buying supplies from the outstation. So we do expect to have a wider impact of the solar panels in terms of trust and availability of vaccines in the future. And we will see that during the next 2 years. So now in terms of how the actions to engage the communities. So maybe I can take a step back to explain what we mean by participatory approach. So what we mean here is really involving people in the projects to encourage the ownership and involvement, to have, when we work, a specific posture to encourage sharing of knowledge and learning and discovery from them. And we use it, notably using different methods and tools to collect knowledge from the farmers about the disease, the impact it has on them, and the way they manage when there's disease to the livestock. And we also use it to co-design strategies with the stakeholders. So I don't think I will have time, we'll see later. We have a quite nice video showing some of our activities about participatory approach in the CIRAD YouTube channel. So hopefully you'll be able to have a look. Some of the actions first, of course, is whenever we want to go in the field, it's first very important to do some advocacy work before going. So really contacting the state veterinary authorities and the community leaders, visiting them before getting there, and also to let them know about the project and things we want to do in the communities and why it is important. It's always very important to do that before starting work and villages. Another very key component here is to build the network of community animal health workers, because when you want to reach communities that are very far away and hard to reach for the veterinary services, well, you need really to have those community animal health workers to do the work of raising awareness about the diseases, about they would be the ones that can deliver vaccines to farmers, and also do some reports if there's some suspicion of disease. And here we have a whole kind of training activities to train some members of the communities to become community animal health workers. So you have kind of state recognized curriculum for them, so they receive a certificate, and they basically from there can sell their services. So it's kind of also an economic chance, opportunity for them to have a market value to vaccination and basically control and surveillance of diseases. So part of our work is, selecting and training those cows, and from there really making sure they are linked with the veterinary services, and being sure that they training them in doing vaccination. So it's things we've done, a few campaigns of vaccinations to get them started and linking them with vaccine distributors to ensure that they have a supply when there's a demand from the communities. Of course, I mean, if you want to scale up this type of network of community animal health workers, you need to have trainers everywhere. And we do also training of trainers, so making field vets, giving them certificates so that they can train more members of communities to become themselves community animal health workers. So it's part of the chain to really strengthen the network for disease surveillance and control. Another important type of action is when you want to start, improving vaccination or report of diseases, is to have awareness campaigns associated to it within the community. So usually it involves putting flyers and posters, giving them information about this disease, both in English and in the main languages spoken in the areas. So here I think I can show you what the posters look like. So very simple with a lot of very illustrated information with the symptoms for the diseases, the way it's transmitted, what to do in terms of disease reporting, and what they can do in terms of vaccination. And those type of flyers would be provided or given by the community animal health worker, where they could put their name and phone, so linking them with kind of customers in some ways that would be interested in vaccinating the animals. We also put radio jingles because radio is still one of the main way of getting news in many places in Nigeria. So it's things we've been doing already in the Plateau State, but also in Bauchi State. Now more about really research activity, trying to understand the context of PPR and Newcastle disease. So we started doing epidemiological surveys in Plateau State here represented. So trying to have for both PPR and ND an idea of the level of prevalence of the disease and their circulation. So we worked in 200 villages collecting samples both for serology and virology. And roughly for small ruminants, it came up to almost 2,000 small ruminants sampled. And we have a master student that's now kind of in charge of analyzing the data collected. The lab work has been already done, so we have now the information about the serology and the viruses, but now it needs to be kind of analyzed in terms of epidemiology. And the same for poultry, so getting from almost 2,000 birds samples, and we have also students that are kind of dedicated. Those students are staff of our partner at NBRI that were very, very keen and enthusiastic in getting those degrees and working with us on this project. Another kind of other work we did was, as I was saying, this participatory approach, but here used for both kind of socioeconomics and epidemiological questions. They were actually done in parallel in some villages. So did a pilot study doing some surveys in 20 villages across Plateau states, doing household interviews and focus group discussions, really with the objectives of really having any information about the perceived impact of the two diseases from their own view of the situation of the owners, and also actually knowing their knowledge about both diseases, what is the local name, the type of symptoms, and how often they do see it. From there, we can see afterwards, once we've implemented awareness actions and having the community animal health workers working in those areas, if those perceptions have changed. It was also very important to do this focus group discussions in different groups, focusing either with the males in the community or in the female groups. So we have nothing stopping us from getting the information from the different points of view within the community, which was very important. So as we were saying, I mean, it's for the moment we just collected the data and we are analyzing it. It's a lot of data, both for the sero surveys and for the epidemiological and socioeconomic surveys. So the data is being analyzed now. So I don't have kind of any results yet to show. Let's just say that we will modify or adapt the protocols based on the feedback from the work done in the pilot state and now implement them this year in the 2 other target states, doing the same type of work: epidemiological surveys, socio-economic participatory surveys, doing the training of the communities and awareness activities. Another work that will be starting, and that's where Andrea is heavily involved, is looking into the role of the livestock mobility in the dissemination and the control of the diseases in the areas where we are working. So here we have 2 students working with Andrea, one based in Nigeria, really using again these participatory tools to assess going in the markets, getting information about animal mobility within the states and across the states. And another student based at CIRAD will do more like the modeling work, doing more like the complex network approach based on notably on mobility data obtained by the first student. So this activity will start this year. If you have questions about that, well, you're lucky that you have Andrea with us, so you will be able to ask all the questions you want about it. So the last part is about actions about developing tools and really evaluation of the impact of the project. So our idea is really to be able to develop tools and guidelines to design policies and regarding surveillance and control strategies for those diseases. So we want to have a kind of centralized database where all the data collected for the different actions is made available for the analysis, notably to do modeling and evaluate different vaccination strategies based on the information collected. Notably, now for the surveys, we use phone apps where the people doing the surveys, but also the community animal health workers can directly put the information collected from the farmers in their phone, and from there it goes directly in the centralized database for analysis. Hopefully, from there we can propose kind of easy to use toolkit to the veterinary services for them to keep on adapting the strategies for the surveillance and control of Newcastle and PPR. For the centralized database, we are implementing a web server hosted in CIRAD, where we install different type of softwares to manage the data. So we use Nextcloud, GEOPS, so this Kobo Collect for the collection of data directly from the phone app. So different type of ways to integrate different utilities and be able to visualize data, or even hopefully later to put the risk maps using QGIS or integrating models to visualize control strategies. But it's still, we are hopefully going to open this web server in the next few months and start really being able to use it. Then work done by Andrea and Raphael Dubose is to do the modeling of PPR, notably using participatory modeling approaches, which is really having meetings with stakeholders, animal health actors to understand better how their understanding of the system, about vaccination, about disease control, and from this putting together a common understanding of the system to translate it in terms of a model that can be then used to do different scenarios. So they started the work there, doing already the different workshops, but still have to work from there on their modeling interface. And once they have easy to use interface, what they can use during workshops, interaction with the actors to test different strategies in terms of efficacy of the vaccination strategies, the optimal cost pathways, etc. And hopefully those tools will be integrated in the web portal. So the last thing, which is of course important for us, but also for funding agency, but also for our stakeholders, for the Ministry of Agriculture and for the communities, is how we can really evaluate the impact of the activities of our project. And we plan to do that in different ways. First, at the end of the project, to go again, do some surveys in selected households to see if now communities are more aware of the importance of animal disease, and if they know they have access to efficient vaccines. We want also to, from these surveys, to have an estimation of the number of farmers who can claim or confirm that their income has increased as a result of the project actions. It would be kind of a quantitative indicator that the stakeholders, policymakers could relate to more easily, let's say. But another way to see if we have better awareness and if our tools to improve a report of diseases have indeed worked is by looking at the number of disease reporting, but also of the investigation of those reports. Have they increased by the end of the project or not? And also in terms of vaccination strategies, well, if those kind of strategies we are recommending, are they really improving the situation? Well, our plan would be to do some comparative vaccination campaigns in different small areas within plateau states, and compare it with just a place where they just do their normal type of vaccination scenario, and to really see if we have an improvement of vaccination coverage. So hopefully from there, we can provide some strong proof that our actions have a big impact for surveillance and control of diseases. And we can then present the tools we've developed to the Nigerian governments, to funding agencies, and really provide them with guidelines that hopefully they'll be able to follow and implement to other areas within Nigeria. Of course, for that, hopefully they can provide some fundings, or hopefully we see that we can find some sustainable way through the purchase of vaccines by the communities. Maybe it will bring some kind of economic sustainability in some of the actions for the control of the disease. But already we've seen some interest in support from different international funding agencies to do the same type of activities as we've been doing, especially about capacity building. So for the training of community animal health workers, for the installation of solar panels of vaccine productions, we are already in discussions, or maybe it's already some agreements in doing those activities in different places. So it's looking like we will have some ways to scale up some of our activities. So that's it. I think I've been providing a very broad overview. Hopefully it was of interest to all of you. Thank you.
Just what I was hoping for. I have to say, this seems like a really well thought out, well-designed approach to capacity building at a local scale for anything, certainly any disease, human or animal. It involves locally appropriate technology, the needs and gaps that are present in specific local areas. So are you working with other organizations to spread this more generally beyond Newcastle disease and petits ruminants?
I guess this kind of integrative approach based really on participatory methods, it's really something that within our research unit at CIRAD, within CIRAD in general, it's something we really try to push and implement in any project we have. So that we have already, each time we have projects that we are trying to prepare, we want to involve us in different projects. We try to have this kind of approach where a bit more like a bottom-up approach where you really try to have the view of the different actors in building a common understanding of the situation, of the issues, so you kind of improve your chances of acceptance and of sustainable impact as well. So it's something, for example, we try to implement for other projects now. We're implementing for PPR, but I think many different projects for CIRAD are based on this. And sometimes it's not only about animal disease, it's about the whole, let's say, health of the environment, so more like a One Health approach as well. So that's like this a big project that is being now starting in Senegal. That's really like this about the really a One Health approach to a situation specific to an area in Senegal. And it will be very interesting for us. We are starting now to be able to see and prove that this approach is really bringing something more and some innovative solutions to issues that have been around for quite some time now. So hopefully we'll be able to prove to funding agencies like OIE, FAO that those are some very interesting ways to go for issues related to agriculture and other.
How do you identify the leaders in villages that you need to work with? Is there some common thing, or is it just different from village to village?
Of course, we heavily rely on our partners in Nigeria. I mean, they have an extended knowledge of how things work in their country, and it seems to be quite complicated. I mean, you have protocols to follow with local chiefs, staff, maybe no governmental authorities, but they have authority within their community because they are recognized as traditional chief within the community. So you have to be sure that you have identified the right person to contact, both at official authority level, but also at the traditional authority level. And from there, if our direct partner at the NVRI do not know them, they always know someone who knows who to contact. So it's from there we trust them a lot about that.
I think to grow this capacity at these levels of villages, do you see challenges in some form? Because I think, of course, language barriers might be there, acceptance barriers might be there. But what do you think if we were to develop a project like this? What would your suggestions to us or others here, for instance?
Okay, I guess when you want to build this type of project, there's always a lot of efforts first in meeting with the different actors to understand what's actually the situation and what are the issues. Building this understanding from the different point of view is key to be sure that you can bring something that may be accepted by the whole community. I mean, you will never be able to find maybe something that will be fully accepted by everybody, but by taking into account their point of view, you can find maybe the situation that will be most acceptable by everybody. And well, in Nigeria, you have, I mean, it's especially complicated context because you have a lot of, well, first insecurity due to terrorism, but also for them, it's more like conflict between communities. So really communities of different religions, but also of different practices in terms of livestock practices that you have to deal with. And there are some things that will be always very complicated. And as you are coming from the outside, you really must rely a lot on very strong local partners if you want to be able to go somewhere and really be able to have some actions.
By the way, I just should say that your idea of putting solar panels was incredibly interesting. I think it tells how a solution that an epidemiologist might not have thought or a virologist would have such a large impact, because I know very well it's a big challenge. In fact, even in the US, where we have mobile vaccine allocation centers, we probably need these solar panels on these trucks that we can store these vaccines much more effectively. It's a very good idea. Thanks.
Yeah. I mean, we are very happy with that. I mean, and especially over there. I mean, you have a lot of solar power, and so it just makes total sense. I think we really hope that they will be able to implement it across all their outstation quite quickly, and just that will, I think, improve accessibility to vaccines, but also to medicine or support in terms of diagnostic from vets. Will just be a massive improvement just by those solar panels. And it seems that they are very easy to maintain. So part of it, of course, is they are trained to maintain them themselves, and it seems very easy to maintain. So it seems to be potentially a sustainable solution. Now, of course, we will see now that they've been installed during the course of the project, if indeed there's no issue with it, or if we realize that there are some issues we have not foreseen. But one thing will be when the batteries will have to be replaced, because those batteries usually they have a time span that is limited. Depends on the battery, but maybe 5 or 10 years. So we have to be sure that they include in their financial plans the replacement of those batteries, and hopefully by the increased sales of vaccines, they will be able to put a certain percentage of those benefits for the maintenance of the solar panels.
I was wondering if you have any problem with the security of the solar panels. It seems like an important resource that people might want to diverge.
That's what I was also thinking. But it seems that the outstations usually have some fences, etc. But I mean, if it's placed in areas where you have some Islamist groups being active, if they decide to take the solar panels, there's not much a fence can do either. So we will see. I mean, it's part of the kind of cost benefit evaluations we have to do, but they've been able to keep some generators. Hopefully, it means that they will be able to keep those solar panels as well.
But it might be that you can convince the community that it's more important to have access to vaccines to maintain their livestock than it is to get the electricity.
And the fact that people at the outstation already had some positive feedback from the communities saying that they were more trusting of the vaccines and medicines available from the outstation thanks to the solar panels, it means that they do see already the advantage of having them there. So it's more like if you have some external disruption from outsiders of the communities, but this is much more difficult to evaluate. Of course, we don't know where how things will go, but hopefully they will be able to maintain them.
I have a small idea for you to consider. I don't know whether it works or not in the local place, but if you give people the incentive of charging their phones with this thing by giving some outlets, the amount of power is very small, but it does two things. The free service allows people to, of course, have a value that they feel. And in fact, in the end, you have to create a community that wants to protect the institution in some form. But it's something for you to consider. I've seen this in India. They provide this, and that somehow brings people together, and then they take it as their cost to keep the place safe.
It's true. It's a very good idea. I think it's something that we did mention as a possibility. I think first we wanted to install them and see how it was perceived and see if it was already well perceived as it was. But maybe different things will be needed in different states. Maybe you will have different reactions and maybe different ways you will have to adapt the way you engage the communities with those solar panels. But indeed, proposing access to the energy supplies would definitely be a good way to ensure that it's well accepted.
After the pandemic is over, whatever happens, do you think you would maintain this mix of virtual training and in-person training, or would you rather go entirely to in-person training?
Well, I think it's a bit like video conferences, and we do see in terms of our impact, in terms of emissions of CO2, in terms of avoiding too much traveling. It's quite beneficiary to have this type of hybrid training activities now. So first, giving access to materials for theoretical for first part of the training online, and from there doing the on-site support afterwards. I think it because many of our training activities before were in multiple missions or travels, going 1 week for first training, and then after a few months where they've already collected data or something like this, going again. So it's quite it was maybe not the most sustainable. Like this, maybe we can find a way to have a more balanced, more sustainable way of doing training. But for example, for lab training, we do also a lot more of lab training for this. It's much more complicated to do it online, but we still will try to do the theoretical part, doing some videos to show how things work, but you will still have to go and meet people, and because for something is just there's nothing better than meeting face to face.
Thank you again, Arnaud.
Thank you for having me.
Thank you very much.